In the previous lectures, guys, we spoke about using disinfection, all right, to achieve asepsis and antisepsis. All right, and what is asepsis? Asepsis is just simply like, okay, are you trying to hit that level where um, the surfaces, the instruments in the laboratory, in the theater, in the hospital wards are actually neat. Okay, so to achieve this level of neatness, or to achieve this level where microorganisms have been reduced to a level in which they can constitute any nuisance again, there are basically some processes you should do. All right, one of which being disinfection and the other being sterilization. So let's basically look at how we can be able to use this sterilization to achieve asepsis or antisepsis. Okay, so you can see, let's look at the key differences between what disinfection and sterilization. Disinfection is the process of elimination of pathogenic microorganisms. However, the process is not effective in case of vegetative spores. Now let's look at sterilization. Sterilization refers to any process that eliminates, removes, kills, or deactivates all forms of life. All forms of life. Okay? So some things, or all those spores and all those stuff that are basically stubborn to disinfection, sterilization will wipe them out in one hand. Okay? So sterilization is mostly like the gold standard. Okay? So let's talk about the various methods of sterilization. We have the steam sterilization. This one is used for eradication of viruses, bacteria, okay, including mycobacterium, tuberculosis, heat-resistant spores, okay. So temperature, pressure, and hold time is responsible for elimination of microbes, okay. So the temperature that you use, okay, in the sterilization machine is important to the pressure, the whole time, okay, is all important in what this sterilization. Then autoclaves. Autoclaves, you see, different types of autoclaves machines. We said that autoclaves are basically devices that use steam under pressure, okay, and their temperatures are about what 120 degrees Celsius to 135 degrees Celsius, all right? And the most of the times heat for like 20 minutes, all right? So they can be used to sterilize things like what? Linen, cotton wool, dressings, surgical instruments, okay? And they can also be used to remove all residues on instruments, okay? Then you place instrument, okay, that's like the method. Place instrument packed in an autoclave in an open position. Leave space between the tray of less than 2 centimeters to ensure circulation of steam. Now, porous packs will allow the steam to circulate around the instrument. So just simply like, okay, wait, put all these things here. Okay, I think this one they want to sterilize like face masks. Okay, so basically these things are machines that you actually need to put something inside, right? Close it, then you initiate the process. Okay, they're talking about the hot air, and this one is basically what the temperature is about 160 degrees Celsius, right? And you allow the material there for almost 2 hours. Okay, and this one is hot air, so it uses what? Dry heat. Okay, so you use dry heat for instruments that can be damageable by steam or water. Okay, you use dry heat. Then we have the ethylene oxide. Ethylene oxide relies on the non-corrosive gas action and is used for heat sensitive instruments like what? Endoscopes and electrical equipment. Okay, then we have the low temperature steam and formaldehyde. This one, basically the temperature is about what, 70 degrees Celsius, and is used for heat sensitive and plastic containing instruments. All right. Then irradiation, you can use for industry technique, used for sterilizing single use items. Ionizing radiation, you could use things like atomic gamma irradiation. Okay, then for the non-ionizing what radiation, you use things like infrared or ultraviolet what radiation. Then for the chemical sterilization, you use things like antiseptics, iodine, carbolic acid, and what? Lysol. Okay, so guys, that's it about how we can be able to use sterilization to actually achieve this level of what? Asepsis, or this level of cleanliness that what? Um, Microorganisms no longer constitute a nuisance to us. Okay, so that's it. Bye for now.